From Penn State Health, this is Ask Us Anything About Men's Health Issues. I'm Scott Gilbert. Well, as we know, let's face it, guys, we require a little more encouragement to see a physician. But several important health issues do loom large for men, including heart disease. That's the leading cause of death for all people. And other conditions such as stroke, accidental injury, and depression. We're going to explore many facets of men's health today with Dr. Richard Frey. He's a family physician here at Penn State Medical Group South Lancaster. Dr. Frey, thanks for taking the time today.
My pleasure.
I want to start with the inconvenient truth. I understand it is a real thing. We guys, we're not that good at getting preventive medical care or even medical attention in general, are we?
No, not very good at all.
Why is that?
I think just men think that they're healthier. They believe that they're too tough to go. Minor complaints don't seem to get dealt with, so they don't go to the doctor. Actually, we've had a little increase maybe with some health policies by insurance companies that make their people go once a year for blood work, so we're getting to see that a little more frequently.
Well, that's a good sign then. So, guys, see your doctor. Don't put off that checkup. And throughout the course of this conversation, by the way, I want to encourage you to post your questions and comments in the comment field below this Facebook post, and we'll pose those to Dr. Frey. Anything is within bounds here, because if you've seen some of these interviews before, we do tend to specialize on one particular condition. Today, we're talking about men's health in general, so we're going to touch on a variety of topics. Let's start with a topic, Dr. Frey, that's very much at the forefront in the month of November, Prostate Cancer Awareness Month. Prostate cancer is the second leading cause of cancer death in men, right behind lung cancer, so important to get that screening.
Yeah, so the only thing I can tell you about this screening, though, is it's a little bit controversial. The most important part about it, talk to your doctor. Everybody's got a different risk for that, maybe a family history risk. And certainly we want to be careful about just randomly ordering PSA tests or getting digital rectal exams that oftentimes will be done to try to detect that. As we know, cancer of the prostate, although it's a leading cancer, is not very frequent for a cause of death. It's a very popular, prominent cancer for frequency, but we don't want to overplay it. We don't want to overtreat it because there's a lot of risks in the evaluation and treatment of false positive tests. Elevated PSA, that doesn't really mean you have cancer.
And PSA stands for prostate-specific antigen. What is that, though?
That's a blood test that in normal men, you draw a blood test, and it should be between 0 and 4. If that level is elevated, it typically may mean that you're at increased risk for prostate cancer. Doesn't mean you have cancer. It's a test that's oftentimes used to follow people with prostate cancer, but not always a great screening tool.
And a lot of men probably not really too eager to have that DRE or digital rectal exam either. Another test that's involved, right?
Correct. And that's a fairly simple in-office exam, but like you said, men kind of avoid the doctor, and that isn't one of the things that they're really wanting to have.
And that should be starting at age 40?
Typically 40 if you're at high risk. 50 would be a more common age to start that. If still utilized. So it needs to be discussed with your doctor. Get to your doctor to have that discussion.
That's the bottom line with this. And many of the other topics we talk about today, I'm sure, is continue the dialogue with your physician. This is Ask Us Anything About Men's Health Issues. I'm Scott Gilbert. We are live today at Penn State Medical Group South Lancaster. And Dr. Richard Frey is a family physician here. We welcome your questions for Dr. Frey. Just put them in the comment field below this Facebook post, and we will pose them to him. Whether you're watching this video live or on video playback after the fact, we will get you answers, again, in the comment field. Let's shift to another type of cancer, lung cancer. It is the #1 cancer killer for both men and women, correct?
Absolutely.
All right, so talk a little bit about the difficulty with diagnosing that, because often it seems like it's diagnosed too late.
And that is true. There is not really a great screening tool for certain high-risk groups like 55 to 80 who have 30 years of smoking. A low-dose CAT scan is now the screening test of choice. Prior to that, there really wasn't any good mechanism. Regular chest x-rays don't really show those early, so consequently people present late and they already have metastatic disease or cancer that has already spread outside their lung.
And then you mentioned smoking, but it's worth repeating that is a major cause, perhaps the main cause of this cancer, right?
Actually, smoking is probably associated with close to 95% of lung cancers. So absolutely, you got to stop smoking.
A A lot of lifestyle choices we'll be touching on this interview, and that's a big one right there. Try to and get away from those cigarettes if you can. The biggest killer is heart disease. It's responsible for 1 in every 4 deaths in the U.S. It's the biggest killer of men, of course. So what's the key to trying to get an early handle on heart disease, or better yet, preventing it?
Well, obviously, prevention is the key. So talk about the major risk factors. Cigarette smoking, we keep talking about that. Diabetes and high blood pressure. So if you don't get to the doctor, you're not going to know that you have those problems. Consequently, if you do, you should have your blood pressure controlled. You should have your diabetes controlled. And if you're smoking, cut back or try to stop.
Mm-hmm. All right, all good advice there. And more than half of people who die of heart disease, though, have experienced no symptoms, no obvious symptoms at least. That sounds kind of scary.
Well, it is, and I think that that's part of the point of trying to do early screening, telling people, look, you're at risk. You come in for a routine physical exam and you're a smoker, well, then that's putting you at risk. And these are not secrets. We know this. And so to be at high risk, you're probably having one of those 3 things.
And so the importance of monitoring your blood pressure, perhaps even more important with some new guidelines that just came out from the American Heart Association that lower the threshold for hypertension. But I imagine, is that going to change anything you do in your office?
Well, not directly, but these things, when they come out, they kind of get sift through the medical community. We look them over, we work on that and kind of come to a good resolution. But it's clear that better control is important. And blood pressure affects people over a lifetime, not necessarily one reading causes a stroke or a heart attack. It's really year in, year out elevations that cause problems. So we just have to be a little bit tighter at following recommendations.
You're watching Ask Us Anything About Men's Health Issues from Penn State Health. I'm Scott Gilbert alongside Dr. Richard Frey. We are at Penn State Medical Group South Lancaster, and we welcome your questions and comments. Just add them to the comment field below this Facebook post. And if you like this content, as we hope you do, make sure you share it on your feed so other people will hopefully be able to access it and benefit from it. We were talking about heart disease. I'd like to talk about a very closely related condition, stroke. You touched on that briefly, but what are some steps that you encourage patients to take to try to mitigate stroke risk? Is that similar to trying to lower the risk of heart disease?
Absolutely. All cardiovascular blood vessel problems related to the heart or the brain, or to your legs, for instance, are all related to the same risk factors. Stroke occurs in more frequently in people with irregular heartbeats. Atrial fibrillation, certainly a lot of people have heard about that, and those people are at higher risk of stroke. But in generally, it's the same guidelines. Control your sugar, quit smoking, get plenty of exercise, which we haven't really talked about. A good 30 minutes a day of exercise is great for prevention of all these cardiovascular things, and including the diabetes, which can be helpful as well.
And if people think, well, 30 minutes a day, that's a lot. Is a little bit less than that still beneficial, more beneficial than none?
Anything better than what you're doing. Even, 150 minutes a week, we'll take that. But if it's 10 minutes a day, we'll take that as well. Anything better than being a couch potato.
Yeah, put a treadmill in front of the TV. And when you're watching that football game on Sunday, right, you can be moving while they're running on the screen. I want to shift to something that is actually the 3rd leading cause of death among men, and that is accidental injury. People may not realize that it's that high, but what are some types of injury that you see most commonly in your practice and that your patients experience?
Well, particularly in men, there's really 2 things. One would be work-related injuries. Men tend to work with more risky jobs, more machinery, and also burns happen to be a big thing for accidental injuries. Outside of that, it's just the sports we do. It's the activities we do. Bicycling, we get a lot of bone fractures in men because of things that they do. Maybe that's inherent in men to be more aggressively risky with activity. But it also can be some social pressures that are put on by other people. Yeah, you can do that, or I can do better. So we kind of put that pressure on ourselves, and that's a societal thing. I'm not going to change that necessarily, but being careful, being thoughtful, very important in trying to minimize risk from injuries.
When doing research for this interview, I found it rather surprising that men are actually 4 times more likely to commit suicide than women. That's a staggering statistic. And do we have any idea why that's the case?
Partly because men probably the same type of social behavior, they put it off. I just need to work through this. And sometimes dads will tell their young sons the same thing. Oh, get over it. You're depressed. It's not a problem. But
internalize it.
They internalize it, right, and they don't know who to go to because they're embarrassed about it. And it occurs in young men, adult men, high school men. And the point is they don't get the help that they need. And medications do work, but if you don't get to the doctor, you can't get referred or you can't be treated.
So it's not just about heart disease, not just about cancer, but also some of these perhaps less visible illnesses such as depression we have to watch out for.
Correct. And it's being able to admit that and getting comfortable with your provider to feel like, hey, I can talk to him about this, him or her about this.
You're watching Ask Us Anything About Men's Health Issues from Penn State Health. Dr. Richard Frey is here to answer your questions. We're at Penn State Medical Group South Lancaster, and we hope you will add your questions to the comment field, whether you're watching this video live or on playback. Let's talk a little bit about diabetes. Some staggering statistics are out there regarding diabetes and the likelihood that in their lifetime, men will contract that. Tell us about that.
Yeah, so we're seeing an increase, and I read something the other day that if you were born in 2000, you have about a 30% chance of developing diabetes as a male. Usually that has to do with increasing numbers of obesity, lack of exercise, poor dietary and exercise habits. And, as a society, we're becoming more obese. We're doing too many, meals at McDonald's, I think. And so exercise and eating correctly are going to decrease that risk. Exercise being that 150 minutes a week I like.
So we as a society are becoming more obese. That's leading to more diabetes. And diabetes, in turn, can lead to other health problems, right? It doesn't exist on its own island.
Correct. And it's certainly going to contribute to an increased risk of cardiovascular disease, going back to the heart attack, the stroke concept, and other things like poor vision, peripheral vascular disease, and neuropathies, things that make you not feel correctly in your toes or your feet, all because you have uncontrolled diabetes.
And alcohol and tobacco use, a higher incidence of that among men?
Sadly, it still is, and they kind of go together. If you drink too much, you're more likely to smoke. If you smoke too much, you're more likely to drink. Obviously, goals for men, no more than 2 alcoholic drinks per day. If it's more than that, you probably are overusing alcohol. That's going to be associated with other medical problems as well, including heart disease and including neuropathies. So that's a problem. And we've already kind of talked about the smoking enough to say that that affects everything.
It's in that bigger bucket of lifestyle choices. So not smoking, making sure you're eating well, making sure you're exercising. Not to lecture you guys, but come on, we've got to stay healthy out there. And we've got to go to the doctor too when we think we might have an issue, or even before that. There are some conditions that are unique to men that men may be especially hesitant to bring up, even to their physician in a one-on-one setting, such as erectile dysfunction. Yet it's very common, especially for men in certain categories. Tell me a bit about that and the incidence of that.
So it's becoming more frequent, mainly because it's a early sign of atherosclerosis, hardening of the arteries. It is a blood vessel problem. That's what occurs. And already we've spoken about the risk factors, diabetes. The other thing is that maybe people should recognize that there's a lot of medications that are treating some other problem that affect your ability to have an erection. So consequently, that can be the problem that men aren't thinking about. They just come in and say they want a pill to help that problem, but really they're not looking at the underlying cause.
So they want to treat the problem without actually looking at what's causing it in the
Correct.
first place.
Yes, that's right. So you really need to look at the whole picture and then make an assessment as to whether the medicines are appropriate, or you really need to look harder at the cause of the problem.
Do you find that men are somewhat embarrassed to bring up that, or even other health issues for that matter? I mean, did you ever get patients in here who you can just tell there's something on their mind and they're just not ready to share it?
Yeah, so you kind of leave open-ended opportunities for people. Is there anything else you'd like to talk about? I sense that there's a problem maybe that we need to deal with. So if it's not that visit, sometimes they'll think about it, come back the next time and maybe get to it. But I think it's just being able to take the time to address men's needs, and they have to express them.
And men, we welcome your questions here. If there's anything on your mind, or ladies, if there's a man in your life and you're a little concerned about something with regard to his health, feel free to add your comment or question to this Facebook post, and we'll pose it to Dr. Frey. So we've really hit on most of the things on my list, Dr. Frey. Any key takeaways that you want men to kind of come away from this interview with?
So the secret of long life is there's no secret. It's eat healthy, it's see the doctor, it's take care of your medical problems, and don't be afraid to see us. And I think that that's the takeaway. If you have some bad habits, you need to work on them, like smoking. That's the biggest thing, and lack of exercise.
Right, but definitely get into the doctor regularly. That preventive care is becoming so important. Like you say, it's a covered benefit under pretty much every insurance plan. Guys just need to get in here and see it.
Yeah, absolutely. Once a year, you can get in your health maintenance exam, usually no copay, and most insurances take care of it.
All right, Dr. Richard Frey, thanks very much for your time today.
It's been my pleasure.
And we appreciate you watching. Again, if you're watching this video on playback, it's not too late to add your questions and comments to the comment field below this Facebook post. And we have been live at Penn State Medical Group in South Lancaster with Dr. Richard Frey. And we thank you for watching Ask Us Anything about men's health issues from Penn State Health.